So in 2014, several of us got together, Dr. Magda Habas, Dr. Henry Lai, Dr. Joel Moskowitz, Dr. Martin Blank, and myself, and we started working on this appeal. And we spent 7 months collecting 140 signatures. That's what we initiated when we released it in May of 2015. And the appeal was addressed to the Secretary General of the United Nations, the Director General of the World Health Organization, and the Executive Director of the United Nations Environment Program. And we were asking for lowered exposure standards based on the precautionary principle or the ALARA principle, given that we don't have enough science yet to write biologically based standards. That's where these need to go. But in the interim, to bring about greater health protection for man and for nature by bringing down these safety standards, which are not safe at all. They're heat-based. They only, we're only being protected against tissue heating or burn or anaphylactic shock. So this is something even many occupational groups already train for, but the general public is not even aware of that possibility. And it's the low level signals that intersect with our bodies now all around us, surrounding us from many sources that are the problem, the ambient environmental exposure conditions. So in the appeal, we outlined what the state of the science was at the time, and you can look this up at emfscientist.org, calling for many changes in practices by manufacturers, by people who have positions where they can change policies to protect children in the classroom, for example, or to design safer products, and generally just reduce the exposure condition. And importantly, set up in our country, set up a national independent research program that is sustained over time so we can really fill the gaps and look into the effects of EMF on living tissue. And so that appeal that was released in 2015 now has over 250 signatories. All of these signatories have published EMF papers in professional journals. We have an additional 15 scientists who have published in related fields. We have gotten a tremendous response over the years about this appeal. Dr. Joel Moskowitz and I generally field all the inquiries coming from the media and from individuals. This appeal has been published, so it's in the published literature. And it also has been mentioned in court hearings, legal documents of all kinds, public testimony, and the media. So we do see the impact. It's the reason why it's so persuasive is that this is signed by the scientists who have done the research, and they know there's a problem, and they're very courageous to have signed it. You have to know that many scientists that we interacted with said they could not sign it. Why? Because they're younger. They still have a family to put through college and to raise a family, and they are concerned that they might lose their job, lose their research money, and they just can't afford to sign it, or they work for the industry. That's the other thing. So we appreciate that, and we're so glad that those that were able to be visible on this matter to show up and sign it, that we're all standing together. And by the way, they represent 54 different nations.
I'm here with disturbing news about our favorite gadgets, cell phones, tablets, Wi-Fi, etc. Putting it bluntly, they are damaging the living cells in our bodies and killing many of us prematurely. I'm Dr. Martin Blank from the Department of Physiology and Cellular Biophysics at Columbia University. It is distressing for me and more than 160 colleagues who today are petitioning the United Nations requesting that they address this problem. We are scientists and engineers, and I am here to tell you we have created something that is harming us, and it is getting out of control. Before Edison's light bulb, there was very little electromagnetic radiation in our environment. The levels today are very many times higher than natural background levels and are growing rapidly because of all the new devices that emit this radiation. An example that a lot of us have in our pockets right now is the cell phone. One study shows that as cell phone usage has spread widely, the incidence of fatal brain cancer in younger people has more than tripled. We are putting cellular antennas on residential buildings and on top of hospitals where people are trying to get well. Wireless utility meters and cell towers are blanketing our neighborhoods with radiation. It's particularly frightening that radiation from our telecommunication and power line technology is damaging the DNA in our cells. It is clear to many biologists that this can account for the rising cancer rates. Future generations, our children, are at risk. These biologists and scientists are not being heard on the committees that set safety standards. The biological facts are being ignored, and as a result, the safety limits are much too high. They are not protective. More protection will probably result from full disclosure of possible conflicts of interest between regulators and industry. Rising exposure to electromagnetic radiation is a global problem. The World Health Organization and international standard-setting bodies are not acting to protect the public's health and well-being. International exposure guidelines for electromagnetic fields must be strengthened to reflect the reality of their impact on our bodies, and in particular, on our DNA. Although we are still in the midst of a great technological transformation, the time to deal with the harmful biological and health effects is long overdue. We are really all part of a large biological experiment without our informed consent. To protect our children, ourselves, and our ecosystem, we must reduce exposure by establishing more protective guidelines. And so today, scientists from around the world are submitting an appeal to the United Nations, its member states, and the World Health Organization to provide leadership in dealing with this emerging public health crisis.